Welcome to Module 13, the renal system. I want to briefly go over the functions of the renal system and then take you into our topic of discussion today, which is urinary tract infections. The renal system consists of kidneys, ureters, the bladder, and urethra. In a normal human anatomy, there are two kidneys that lie on each side of the vertebral column in the abdominal cavity behind the peritoneum. With them positioned between the abdominal organ and back muscles, this is what protects them from trauma. Each one of your kidneys have around 1.2 million nephrons, which is what is your functional unit of the kidneys. This is where your urine is formed. It then funnels down into the ureters, which are around 30 centimeters long of smooth bundles that pass through the posterior bladder wall. The bladder, made of smooth muscle fibers, begins to fill with urine, and as the urine amount increases, the bladder becomes thinner. When the bladder communicates it is full, the urine then goes through the urethra that extends from the inferior side of the bladder and passes the urine outside the body. The urethra has two sphincters, internal and external. Your external sphincter is under voluntary control. So how do you have the urge that you need to go to the bathroom? When the bladder reaches about 250 to 300 mLs of urine, it starts to contract, which is what causes the internal sphincter to relax. This is when you get the urge that you need to find a bathroom. It's interesting to see the difference in length between a male and female urethra. A female urethra is approximately 3 to 4 centimeters long versus 18 to 20 centimeters long for a male. Urinary tract infections is an inflammation of the urinary epithelium that can occur anywhere along the urinary tract. Remember a few moments ago we were talking about the difference in length of the urethra for males and females? Well, this plays an impact on females being so susceptible to cystitis due to their short urethras. UTIs can be uncomplicated, which most are, or they can be complicated. Generally, UTIs are mild and uncomplicated, but in individuals with health problems that compromise their immune system, complicated UTIs can develop and urosepsis can occur. There are several factors that helps the body protect itself from UTIs. A low pH is important, high osmolarity of urea, the presence of TAM horsefly protein, and secretions from the uroepithelium, which provides the body with a bactericidal effect. The two types of UTIs are acute cystitis and acute pyelonephritis. Cystitis is an inflammation in the bladder and the most common site for a UTI. The most common infecting microorganism for this is E. coli. Remember when we talked earlier about women being more susceptible? Well, this is because of the close proximity of the anus to the urethra and how short the urethra is. Many individuals may be asymptomatic, but your patients with cystitis may report burning on urination, frequency, and urgency. The patient may also present with hematuria, cloudy urine, and flank pain. You will notice in your elderly clients that they normally present with confusion. That's why anytime an elderly client has reports of confusion, the provider will automatically do a UA, because that might be the only symptom they have. UTIs are diagnosed by doing a urine culture. If bacteria is present in the urine culture, an antibiotic regimen is prescribed to the patient. Okay, so we determined cystitis is inflammation of the bladder. Well, pyelonephritis is inflammation in the upper urinary tracts. This could be the ureters, the renal pelvis, or anywhere else in the upper urinary tract. Urinary obstruction and urine reflux are the most common causes of this. E. coli is often associated with this infection as well, along with Proteus and Pseudomonas. The onset of symptoms for these patients is acute. They will have fever, chills, flank, or groin pain. Sometimes it can be difficult to diagnose cystitis versus pyelonephritis based off of symptoms. It is also diagnosed by using a urine culture and urinalysis, and by the difference of signs and symptoms. White blood cell cast in urine will indicate pyelonephritis, but unfortunately, they are not always present. These patients are also prescribed an antibiotic regimen that is usually longer than the regimen with cystitis. And this concludes our discussion on urinary tract infections.